All right, welcome. In this explainer, we are taking you right inside the world of elite microsurgery. We've taken a recent global webinar and transformed it into a visual breakdown of how the world's best surgeons are literally pushing the limits of what's possible in repairing the human body.
We're going to start not with a scalpel or some complex procedure, but with this, a moment of very real, very human vulnerability. This one line from the very start of the Crazy Surgeon webinar is such a great reminder. It shows that even at the absolute peak of their profession, these surgeons are still a community. They're people supporting each other through the intense pressure of sharing their life's work. It really sets the stage for a story that's as much about collaboration as it is about surgery.
Okay, so here's our game plan. First, we'll peek behind that virtual curtain to see what this meeting is all about. Then, we'll dive deep into two massive challenges. First, catastrophic hand injuries, and second, the chronic condition of lymphedema. We'll look at the incredible pioneering solutions, and then wrap it all up by looking at the results and what this all means for the future.
So, let's get into it. You have to understand, this is not just any old Zoom call. The Crazy Surgeon platform is this weekly virtual hub where top-tier surgeons from all over the world, we're talking from Japan to Shenzhen, get together. They share their absolute toughest cases, their newest techniques, and their most groundbreaking ideas. It's basically a global innovation engine, all happening in real time.
Our first deep dive is going to focus on the work of Dr. C.R.A.Z.Y. She presented on what has to be one of the most difficult challenges in all of reconstructive surgery, repairing hands that have suffered just catastrophic trauma. I mean, think about it. The body's most intricate, most essential tools just completely devastated.
So what's the guiding principle behind this incredibly complex work? Well, it's actually elegantly simple. It's all a balancing act. The goal isn't just to fix the injury at any cost. No, the real art is to do it while causing the least amount of damage to the rest of the body. The donor sites where they have to borrow tissue from.
And here's where it gets really, really cool. How do they pull off that balancing act? Well, instead of just grabbing one huge piece of tissue to cover the damage, Dr. C.R.A.Z.Y's team used 5 separate, small, custom-tailored flaps. So think of it less like slapping on a big patch and more like creating a delicate, functional mosaic, piece by piece, to rebuild the hand.
And this is one of the most clever techniques. It's called the preposition approach, and it's all about brilliant planning. What they do is, they actually attach and secure the new tissue flap onto the damaged finger before they even reattach the finger itself to the hand. It's this smart, out-of-order sequence that leads to less time in surgery and, most importantly, better results for the patient. Now, this kind of outside-the-box thinking isn't just for trauma cases. From here, the webinar completely shifted gears to a totally different kind of challenge.
Yep, the whole conversation pivoted from that acute, sudden trauma to a chronic, life-altering condition, lymphedema. This is a persistent, debilitating swelling that can happen after things like cancer treatments, and honestly, it requires a completely different kind of surgical genius to tackle. So, what is it exactly? Well, you can think of your lymphatic system as the body's super intricate drainage network. But when that system gets damaged or blocked, fluid just builds up, and that causes severe swelling, pain, and a constant risk of infection. For patients, it's a daily battle. And that is the problem that surgeons like Professor Isao Koshima have dedicated their lives to solving. And the solutions they've come up with are just mind-blowing. Professor Koshima, who is a giant in this field, presented his pioneering techniques. And we're not just talking about reconstruction anymore. This is more like replumbing the entire human body, but on a microscopic level, literally creating brand new pathways for all that trapped fluid to drain away.
Professor Koshima's approach makes it clear there's no single magic bullet here. It's about having a whole toolkit of advanced options. He's combining techniques like LVA, that's where they connect tiny lymphatic vessels to tiny veins, with transferring whole channels of lymphatic tissue. And look at that last point. It's fascinating. He's even using AI to analyze all the possibilities and map out the very best surgical plan before he even picks up a scalpel.
And the decision-making gets even more fine-tuned. Here, we see a comparison between 2 different types of tissue flaps they use for these lymphatic transfers. And while both are really effective, Professor Koshima noted that the web space flaps from the foot might just have a slight edge. Why? Because their vessels have stronger muscle cells. I mean, it's that incredible level of detail that keeps pushing the whole field forward. But, of course, after all of this amazing innovation, the ultimate question is always the same. Does it actually work for patients? So the last part of the webinar really focused on the results, the tangible outcomes, and putting these incredible techniques to the test with real patient data. And this chart, wow, it brilliantly illustrates the impact.
In his own analysis of 28 cases, Professor Koshima reported that 60% of his patients got excellent results. And that's not just a number, right? That represents dozens of real people whose quality of life was dramatically improved, whose chronic pain and swelling were finally brought under control. To really put a human face on those numbers, he shared this case study of a 73-year-old woman. She had survived breast cancer but was left with severe lymphedema that just wasn't responding to any of the standard treatments. But after his microsurgical intervention, she saw significant improvement. It's a personal victory that a statistic alone could never fully capture.
And, this kind of success doesn't just happen overnight. Professor Koshima actually walked through how his own approach has evolved over 2 decades. It started with the initial concepts back around the year 2000, then moved to a focus on using multiple channels, and now today, he's integrating artificial intelligence right into his planning. It is a perfect picture of relentless, continuous innovation.
So, here's the crucial point, the big takeaway. The magic isn't just in the operating room. World-class outcomes are built on these 4 pillars. It all starts with that meticulous planning, uses a smart combination of techniques, and then, and this is so important, it absolutely depends on dedicated care after the surgery. Things like compression and physiotherapy. Success is a whole process, from start to finish.
And all of this brings us to one final, big thought. We've seen surgeons collaborating virtually from Shenzhen to Tokyo. We've seen AI helping to map out the human body before an operation even begins. It really leaves us with this fascinating question. As technology and global collaboration continue to erase the old boundaries, what is the next frontier for repairing the human body? What's coming next?